alaikum. My name is أماني Aziz الرحمن. I'm going to talk about communication in medical practice. Is communication important? Definitely yes. We communicate everywhere with everybody. So we can communicate patient with caregiver, patient with administration staff, patient and a physician, within the nurses staff or RT staff, and physician with administration. We communicate with our words, which is actually only 70% of the time. The more is actually with the tone and your body language. Communication is a dynamic process. It takes two to dance, as they said. So it's actually not only one person, but you and the patient or other part that you communicate with. It incorporates the verbal and non-verbal expression, and sometimes it to convey a message. Because you have to convey your thought, your idea, your information and emotion, send from one person to the other person, and sometimes there's factor which is effective. Communicate effectively. So the best thing to do this is to be empathizing, feel the emotion of the other end when you contact or you communicate with them. If you say something, just make sure to summarize it and make sure that the other person understands what they say. The literature said sometimes you summarize it, and when you convey any message, make it clear message. Like, don't say something that vague or not clear, because this can lead to uncertainty in the other end. Sometimes you ask the other person to summarize it to make sure that they actually understand what you mean during your discussion. If the message is not clear, explanation can help, because when you explain and what your rationale and why you're doing this, or you explain why this treatment should be given, investigation should be done, then probably the yield of doing the test or the investigation and the yield of being effective communicator is high. And if this not satisfying, then sometimes you can use the silent, which is you let the other person explain themselves, do not interrupt them. Do the effective reflective listening. Just listen to them with their rationale. Don't say anything and let them ventilate, and then you will understand where they're coming from, which is, we call it reflection. And when they reflect, they will come with their own idea, so they can explain to you what actually their conflict and what their concern. Part of the communication is using spikes, which is 6-step protocol to deliver bad news, and it's coming from literature of the oncology, which is actually 26 pages in how to deal with difficult patient when you deliver a bad news for them. Definition of bad news: any news which is lead to unsatisfaction by the other end. So for us in ER, admission could be possible, consider a bad news. No IV access, no bed is a bad news. Any news which is lead to distress other end, it considered bad news. It's just not only a bad diagnosis or a very unlikely present of method of treatment. Spikes is actually setting up. So you set up the interview, you prepare the place for the discussion. It should be done in a private place, and the other end should be asked if they need to have their significant one with them. So a mom maybe want her husband to be with her, or a daughter maybe need her sister to be with her during the breaking bad news, and sometimes they don't need anybody. And then you ask them about their perception, which is what they actually understand about the disease or about the process, because they may have an idea and make your discussion is easy, and sometimes they don't. So you get that it's actually invite them to say what they want to learn or to know first. Does they want to know about the prognosis, or they want to know about the treatment? The knowledge that they may have difficulty to understand and grasp the knowledge that you're going to say to them. And then you invitation, which is not invite them to the room. You deliver the news, and when the news should be delivered with a good information and accurate information, without any lying, without any changing of the fact. And it should be the language which is used should like a 6th grade language, so very basic, very easy. Avoid all the medical jargon, because you don't want to use a very complex terminology that they may not understand it. And while doing this, you have to address their emotions, so you have to be empathizing, you have to listen very carefully to them. You should not actually judge their opinion or their a decision that they want to take, and you should give them a support, like an emotional support. Use your body language to do this. So teaching communication is effective, and why I choose this topic, because there is always a negative aspect of something. So a negative aspect of miscommunication between a colleague or parents can lead to less motivation and inactivation for the person. It can confuse the opinion and confuse people to understand what you want them to do, and increase the intergroup tension, cause negative emotion, and the other person will be violent and practice violence behavior, create or increase antagonism. And at the end of the day, it can lead to stress and frustration, and which lead to burnout, which is very difficult to deal with if it's increased and add up with long period of time. Hope the mini presentation was effective for you guys, and thank you for listening.